It's a very busy morning. Major developments on the coronavirus. The 85,000 cases in the U.S. now the most in the world, and at least 1,200 deaths are being blamed on the virus. Here in New York, the toll on doctors and nurses is growing with each passing day. Yesterday, the number of patients in need of hospitalization jumped 40%. To help, the Navy will deploy the USNS Comfort to New York tomorrow. It's a floating hospital that will be used to treat non-coronavirus patients. A similar ship arrives in Los Angeles today. Meantime, amid his push to get America back to work, the president says new guidelines are being established to help states decide when it's safe to begin pulling back on social distancing. Our team is covering all of it. NBC's Gabe Gutierrez starts us off from Elmhurst Hospital, one of the many in New York that is completely overwhelmed. Hey, Gabe, good morning.
Hoda, good morning. There's already another line for testing here this morning. The state is scouting new locations for more overflow hospitals. Governor Andrew Cuomo in New York says the most pressing need is still ventilators. Doctors are being allowed to split ventilators to help 2 patients at a time. But overnight, President Trump said he wasn't so sure the projections for New York were accurate.
This morning, the U.S. has the most reported coronavirus cases in the world.
I've never seen a health crisis like this before.
In New York, the number is skyrocketing, now more than 37,000, a triple-digit spike in deaths in just one day. Our station, WNBC, got rare access inside a hospital in the Bronx. The ER is packed. Patients with COVID-19 symptoms are isolated. Soon, this triage tent may be necessary. The city just sent 40 ventilators and dozens of more workers to Elmhurst Hospital in Queens. 13 deaths in 24 hours. Outside, the line of patients begins before dawn.
I don't know what's going to happen.
From a distance, we spoke with Ignacio Ramirez, who started feeling symptoms on Sunday. He waited 5 hours in line to get tested.
I have fever, a terrible headache, doesn't stop. It's horrible.
Overnight on Fox News, President Trump casting doubt on the number of ventilators that are being requested in New York.
But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators.
And this from the White House Coronavirus Response Coordinator on the scope of the crisis coast to coast.
To make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now.
The city's EMT response now approaching a crisis, with a spike in 911 calls causing up to 3-hour delays for ambulances and non-emergencies.
In 2 weeks, we have a 20% or 30% people out sick.
Across the country, major cities are starting to see an increase in coronavirus cases and brave doctors risking their own health. In Atlanta, anesthesiologist Dr. Michelle O is intubating critical COVID patients.
You're aware that every moment you're spending in this airway, you're possibly aerosolizing this very infectious virus.
Her husband is also a physician. They have 3 children. Every day, she worries about carrying the virus home. This past weekend, she and her husband redid their will to make sure their children are cared for in case they don't make it.
It is a real possibility now that we could lose one or both of us. It's affected our home life, it's affected our work life, and there's really nothing that's separate from the virus at this point.
Here in New York, Governor Cuomo says there is enough personal protective equipment, or PPE, for the moment for doctors and nurses, and he attributes any spot shortages around the city to distribution issues. Again, he says the main problem right now is the lack of ventilators. Savannah.
All right, Gabe, thank you so much. Now to the overnight drama tied to that massive economic rescue package on Capitol Hill. There are fears that today's scheduled vote in the House could be delayed because of the objections of a single congressman. NBC's Tom Costello has the latest on that this morning. Tom, good morning.
Yeah, good morning. That's right. There's now a mad dash. Members of Congress trying to get back to Washington as fast as possible to vote on that emergency rescue package. The concern is that a single member of Congress may not go along with the plans to vote today. This morning, members of Congress are scrambling back to Washington over fears that passing that massive $2 trillion relief package could be delayed. With several lawmakers testing positive for the virus and others exposed at home, House Speaker Nancy Pelosi was planning a long-distance voice vote. But overnight, new concern that at least one member of the House, Republican Thomas Massie, might force a recorded vote, meaning at least 216 members must show up to vote on the House floor. The rescue plan, aimed at helping American families and businesses, would provide an additional 13 weeks of unemployment benefits, plus an extra $600 per week for 4 months. It would send loans to small businesses that retain their employees, and $1,200 to most adults, plus $500 per child. The Treasury Secretary, Steve Mnuchin, says those individuals could see that money direct deposited within 3 weeks. It comes as President Trump is previewing new guidelines for state and local officials grappling with the outbreak, allowing them to set their own standard for social distancing.
We may take sections of our country, we may take large sections of our country that aren't so seriously affected, and we may do it that way, but we've got to start the process pretty soon.
The president, in a letter to America's governors, says his administration will classify counties as high, medium, and low risk based on coronavirus surveillance testing, mapping the spread of the virus. But some doctors are already blasting the administration's plan, insisting the proposal is impractical and premature.
I think it's lunacy. It's the exact type of messaging we don't need. We need 8 to 10 weeks of a national lockdown, not a county-by-county approach that is never going to get implemented.
Now, the pandemic's devastating financial toll is coming into focus after a record 3.2 million Americans filed for unemployment benefits last week. The question this morning, when can things get back to normal? NBA All-Star Steph Curry with Dr. Anthony Fauci on Instagram.
What metric are you looking at to be able to then determine at mass that large gatherings, sporting events, those type of things are okay?
We can start thinking about getting back to some degree of normality when the country as a whole is turned that corner and start coming down.
Okay, also this morning, Dr. Fauci is responding to concerns that President Trump's desire to have the economy reopened by Easter may in fact run contrary to the advice of his own medical experts.
I think that the president was trying to do, he was making an aspirational projection to give people some hope, but he's listening to us when we say we really got to reevaluate it in real time, and any decision we make has to be based on the data.
So the White House is interested in states deciding on their own, county by county, whether certain counties should be on lockdown, if you will. But the concern is if people move from county to county to county very easily back and forth, that may make those types of quarantine situations, those lockdowns, really difficult to enforce. Savannah?
All right, Tom, and we're going to talk about that very thing with our doctors now. Medical correspondent Dr. John Torres joins us from home, and NBC News contributor Dr. Joseph Fair is with us. He's a virologist and outbreak responder. He was on the front lines of Africa's Ebola crisis. Good morning, gentlemen, to both of you. Before we get into this county-by-county idea, I do want to ask you about the president's remark last night on Fox News. He said, I don't believe you need 40,000 or 30,000 ventilators. You go into major hospitals, sometimes they'll have 2 ventilators. And now all of a sudden they're saying, can we order 30,000 ventilators? Dr. Torres, why would we need so many ventilators? Does the president have a point there?
And that's the plan number one you do when there's any kind of disaster. You make sure you have enough equipment that you can supply the patients that you're going to have. And so we know these patients are cropping up, especially in the hotbed areas, and those ventilators are crucial to keeping people alive. So if you only have 3 or 4 ventilators and you only need 2, but all of a sudden you need 20, well, you're going to be behind the 8 ball at that point. But if you have those supplied already, you can start saving patients' lives right away. And as we talked about, they're already starting to try some different tricks to get those ventilators to work better on different patients. So having that supply is crucially important. If you don't use it, you don't use it, but at least you have access to it.
Yeah, and Dr. Torres, I mean, real quickly, don't these COVID-19 patients on average spend a lot longer on the ventilators than the average patient?
They do. Typically, Right. Typically, patients are on a ventilator for a few days, maybe a week or so. These COVID patients are going on there for weeks, 2-3 weeks at a time. And if they're on that ventilator, they're taking that ventilator, you can't use it for any other patient, so you're going to need even more ventilators for the new ones that are coming in. And that's just something you can't predict at this point how many you're going to have, so you're planning for that worst case or even that moderate case scenario.
Okay, Dr. Fair, let's talk about this White House letter. It was to governors suggesting that there could soon be from the federal government county by county guidance that would assess the risk of these individual counties as low, high, or medium, and that they could adjust social distancing practices accordingly. Could that work? Would that be effective?
It can only work if you have the data, and the data is based on the testing, and you're still seeing that we don't have the testing everywhere. So if you don't have diagnostic tests in each and every one of these counties and everyone able to get the test, there is no data to support that that would work. If there is data, then you could do that. However, that being said, what's going to stop you from going from one county just to the next county, which may be high risk from to low risk? There's no way to enforce that. So I would recommend that the governors ignore these guidelines and stick with their own guidelines that they're doing right now, which is approximately 50% or more of the states are on a commercial shutdown and sticking to only non-essential or essential services, rather.
Dr. Fair, you live in New Orleans. We know that Louisiana is getting hit hard and perhaps going to get hit hard even more so. And when you look at that map that is often put up and it shows New York City obviously is the epicenter with the most cases, is it a tad misleading? Because New York, of course, has more people. But if you start looking at, for example, percentage of cases per capita, where do you start seeing that there are other regions that are experiencing this significantly?
Every major urban hub, so New Orleans, Chicago, Detroit, we're starting to see those as emerging hotspots, and it's not unexpected. You know, the way that we work in this country is we travel to each state. Everybody has family in another state. A lot of people go home to their home areas when they're not working and in times of crises. So you're going to see a lot of transfer between places. And again, without that testing in every place, we're not going to know who has the most cases. We referred to it earlier about Mardi Gras. It was obviously spreading during that time. And, you know, as the individual said earlier, you weren't only passing beads, you were probably passing coronavirus too. So New Orleans is definitely of major concern right now, as are many other cities. And that's going to spread out to the countryside as well, because it's common and natural human behavior that if you're in a major urban city that's undergoing a crisis, you're going to want to get out to your family that may live in the countryside. So we can't call anywhere low risk right now.
Dr. Torres, I mean, we've heard, you know, the stories from the front lines of doctors, particularly in the New York area, about the lack of resources, lack of that personal protective equipment. Is that something that's a problem nationwide?
It seems like it's a problem nationwide, and doctor friends I've talked to in other parts of the country are saying the same thing, that they're hearing that there's a lot of supply, but in their own unique situation, they're having to reuse masks and reuse some of that PPE. And the big concern with them is the fact that, you know, they might get infected. If they do get infected, they could get it to their families, they could pass it on to other patients, or they might not be there to take care of them. They say it's getting better, and it's much better than it was a week ago, but it's still not where they want it at that point where they can use it and they can feel very comfortable being able to use them as much as they need to.
All right, Dr. Fair, Dr. Torres, thank you so much. And I know you'll be back a little bit later in the show. We've got viewer questions, including one that a lot of people are asking, does ibuprofen really make the virus worse? Also, does it impact men more than women? Those were some of your questions that we'll answer in a few. But for now, Hoda, we'll send it back to you.
All right, Savannah, thank you. Worldwide, cases of the coronavirus now total more than 500,000, doubling in just over a week. Today's senior international correspondent Keir Simmons is in London with the very latest on the situation overseas. Hey, Keir, good morning.
Hey, Hoda, good morning to you. While Europe appears to be slowing infection, Spain is really struggling. We're just hearing about a spike in deaths there in Spain of around 15%. And get this, Hoda, thousands of tests that were sent to Spain from China are reported to be faulty. But some inspiring news from here in the UK. Last night in these streets and around Britain, people came out and applauded their health workers. And one little girl's story is really stealing people's hearts. This is as close as 4-year-old Mila can get to her dad and sister to protect her from a virus that thrives on human contact.
I've got leukemia.
Her rare form of leukemia puts her at risk, and like so many around the world, self-isolation means segregating family members.
I kind of feel I've lost a husband and my daughter as well, but trying to balance the emotions.
In hard-hit areas of France, they're putting patients on trains to move them away from overstretched hospitals. There are signs Europe is winning the battle. Infections are slowing. From Spain to the UK, people in the streets clapping and cheering overwhelmed health workers. Even the royal children, Princes George, Louis and Princess Charlotte. Prince Charles pictured for the first time since news he has coronavirus. The US military facing infections on the aircraft carrier USS Roosevelt, a base in South Korea, and in Western Germany, 2 US Air Force personnel isolated as soon as they showed symptoms. Their commander speaking to Today.
European leaders, the president himself, have described this as a war. Is it like a war?
I think that's a good approach. I've approached this just as we would any adversary, and you have to understand the adversary.
Disinfecting gear, closing their children's school and playground, operating a drive-through clinic. Colonel Alicia Smith coordinates healthcare for 7,000 service members and families in 5 countries. She's working 15 hours a day and staying in touch with folks back home in Tennessee.
I actually was yelling at my mom yesterday about her being out and about because she's considered high risk. So we, pull at mom sometimes.
And we cannot forget, of course, those servicemen and women around the world who are away from their families dealing with all this. And Hoda, we are just hearing that the British Prime Minister, Boris Johnson, has tweeted that he himself has tested positive for coronavirus. So for this country that needs leadership, we don't know what his symptoms are, how serious they are. But, of course, that will be a blow for this country, Hoda.
Wow, some breaking news at the end there. All right, Keir, thank you so much. I know you'll follow up on all of it. What do you say we turn now to Mr. Roker, who is once again working from his home? Hey, Al, how's the weather looking?
Well, Hoda, we've got some severe weather to talk about. It already firing up from central Illinois on into Indiana. We're watching this system push through, and as it does, we've got a risk of severe weather for 7 million people today. Hail, damaging winds, possibility of tornadoes. But we're really concerned about tomorrow. 41 million people at risk. Hail, damaging winds, tornadoes. This hail could be upwards of 3 inches in diameter. These storms are fast moving. Will be moving up to 50 miles per hour. It's not unusual to see Illinois tornadoes in March. Tomorrow, it's going to be a windswept rain pushing through. Sunday, heavy rain entering into New England, snow showers in the upper Midwest with this thing, and rainfall amounts from the Dakotas all the way to upstate New York, back into the Mississippi River Valley. We're talking anywhere from 1 to 3 inches of rain before